Hello everybody, today is I'm recording this on February 6th, 2020, and we're talking about coronavirus. So today the official numbers are 28,368 infected, 3,863 critical, and 566 is the official death count from coronavirus. Over a dozen countries have active cases right now, with most of them in the Hubei province and specifically the city of Wuhan. I think that those numbers are probably what I would call, I guess, a floor, or, less diplomatically, BS. I don't think that they're really the numbers, the real numbers. And the reason I say that is because when I started becoming a pharmacist, I lived in an apartment, I had roommates, and one of my roommates is from Wuhan. And I reached out to him and went to dinner with him and his wife, and we sort of talked about what his relatives are saying in Wuhan on the ground. What's the intelligence there from Wuhan? The problem is, of course, is that you can't really trust the information that's coming out of China, because it's being sort of released by the Communist Party in China, and the Communist Party's number one goal is to continue the Communist Party. So they use propaganda, any means necessary to make themselves look as good as possible. So my friend was telling me, Woody, he was telling me he has 5 relatives, an aunt who's a nurse who has the coronavirus, and 4 others. Knock on wood, they're in pretty good shape right now, but none of them were ever undergone any kind of a PCR testing to see if they really had coronavirus. The doctors told them they had it. Basically, they just look at the chest x-ray, they see that they have pneumonia, and they send them home with medication. Most people are not being put in the hospital unless they're extremely severe. There have been reports of people actually being turned away in Hubei province from the hospital for not being sick enough. And basically what's going on is that healthcare professionals in Wuhan are just trying to triage people and make sure that they have enough resources for their sickest patients, because those patients they might need supportive care, which could include being put on a breathing machine, because the coronavirus really affects the respiratory tract. That's where it lives, and that's where it kind of causes damage, and it makes it really hard for a lot of people to breathe. That's basically why I think that the numbers are wrong. I think it was a little embarrassing that the WHO director is bending over backwards to congratulate China on how good they're doing. The heroes of this outbreak are the people that first reported it. They knew that with their government that they could be in serious trouble for reporting an outbreak. Now think of that. In the United States, I mean, if my neighbor has Ebola, I want people to know about it. I want people showing up in spacesuits and handling that. But in China, what occurred was that people who were telling their colleagues that, I think we have a new disease here. I think this could be an outbreak of something like SARS. One of the heroes just passed away. He actually got the disease himself. He's a doctor. And he said, this looks like SARS. He was chatting with his colleagues. I don't know if it was the censorship police found him and basically made him sign a document that said he would never speak another word of this. Other people were detained because they were talking about this. So the first people, basically, the whistleblowers, if you will, the people on the ground, are saying that there was an issue. In the beginning of December, when there was only a handful of cases, those people were detained, and the patients were allowed to spread the disease. The healthcare professionals were not given the adequate equipment to protect themselves, and now there's an outbreak that is now in over a dozen countries, including our country, the United States. So I don't think that the WHO director should be bending over backwards to praise President Xi. Now, I don't know what the relationship is there with the WHO and China. The WHO has not allowed Taiwan to participate, even though that they're obviously at risk because they're so close to China and they have so many Chinese visitors. So I'm not really that impressed by the WHO. I also think that they drag their feet a lot and calling this a global health emergency. That should have happened immediately. I don't know if they had to get on the phone with China, President Xi, and say, is it okay if we call this a global health emergency? Because it obviously is. And the pictures that we're seeing from Wuhan are pictures of empty streets. There are pictures of dead bodies in hallways, lines around the block for care. So these are not, the picture isn't good. And just throughout China, you're seeing a lot of people not willing to go back to work because they're afraid to get this disease. And that's just not in the Hubei province, which is on lockdown, meaning that people cannot travel to Hubei, they can't get out. Nobody in, nobody out. People have food and everything, but they're not being able to travel freely. But even in China and Shanghai, people are not going out unless they really have to. They're not, they're staying inside. And from speaking with my friend from Wuhan, he said basically they're not leaving the house. And other people from Wuhan are going into other cities. Those people that are actually from Wuhan going into other Chinese cities, they're being quarantined in a very kind of a Chinese fashion, a communist fashion. They're basically having their doors boarded shut so that they can't get out of their house. I guess they're getting they're able to open the door, a crack to get delivery or whatever. But it's very serious in China. I think the reporting on it is a little bit too rosy, to be honest. I think the situation is a little bit more serious than the reporting says. In the United States, it seems like here we're doing pretty good. We have today's the 6th, February 6th, 2020. We have 12 cases. I assume that will go up. They're already looking at people in New York City. And that if there are cases in New York, that would be the first outbreak on the eastern part of the United States. But at the same time, this could have impacts just because people might be afraid to go to cities where there's outbreaks or cities where there's even a handful of cases. Like people might say, maybe I'm going to delay my trip to New York, or I'm going to do, it could really affect a lot of things. There's already a shortage in face masks, probably because they're made in China. We have our global supply chain is in China. People aren't working in China. That means that they might not be making those masks. Apparently they have them in Taiwan. The people in Taiwan are making enough masks to kind of fulfill demand in the country of Taiwan, and they're actually sending some to China. Here in the United States, we can't even really, they're not on the shelves in the pharmacies, and we don't even have an outbreak here, but people are sort of just, if they see one, they're buying it just in case they feel they'll need to use it when they go out. A lot of people are saying you don't really need to do that. You don't need to buy face masks. Really, you just need to, wash your hands, stay away from sick people, which is hard for healthcare professionals. So those are the people that really kind of need the masks, and some of them, they might not even be able to get it. Clean and disinfect surfaces. Basically wash your hands a lot, which really takes a toll on your skin during the winter. So the current treatment is supportive care, which means maybe steroids to help you breathe if you're having trouble breathing. They might be given antibiotics, I'm not sure. If they have trouble breathing, eventually they might need to be intubated to have a machine breathe for them because of the effort it takes to breathe. So I think this is a very serious thing that's happening in China. It has spread in a limited fashion. I think so far the hardest hit Asian country is actually Japan. They have so much travel from China to Japan. They probably have had outbreaks because of that. There might even be more people going to Japan from China than going to Taiwan. So I think that's why they're having an issue. There's people quarantined on a boat right now. It's a messy situation, and it's very interesting, and I hope it doesn't reach our shores, or I hope it doesn't cause any outbreaks here. So I hope you all found this interesting. If you did, please give me a thumbs up and please subscribe. I want to thank you guys for watching. Thanks a lot.